Hi, this is Bryan Lewis. I'm a kidney cancer survivor, and today I want to talk to you all about the PROSPER trial.
And my name is Deb Maskens. I'm also a kidney cancer patient of many years, and I'm absolutely passionate about moving the care for kidney cancer patients forward.
So let's get started. I'm going to ask you, Deb, tell us a little bit about the PROSPER trial.
Well, let's take a step back. Let me ask you, Bryan, have you had a kidney removed?
I have.
And I've had a kidney removed. So for many, many years, the standard treatment for kidney cancer has started with the removal of the kidneys. It used to be the full kidney, and now more so a partial nephrectomy, just the small tumor. But we know that unfortunately for a select number of patients, and that can be depending upon the size of the tumor, that can vary for you, but kidney cancer can come back. My kidney cancer came back, and when it does come back, it means that it's much harder to treat and it's much harder to achieve a cure. The PROSPER RCC study is a really innovative trial, because what it hopes to do is to train the immune system before surgery for patients to have surgery, and then to give an immunotherapy boost after the surgery.
In my circumstance, the first several days and probably several months after your first diagnosis that you have cancer, I called it the white noise period, where lots and lots of information is flowing at you and you just don't know where to turn for the correct advice.
It's really true that when you hear that you have a kidney tumor, that it's likely to be kidney cancer, it's a huge shock. And I think our natural instinct as patients is get it out tomorrow. How quickly can you book me into the OR? But it really is okay. This is big news, and it's a big psychological effect. It's really okay to hit a pause button and to say, I need to think about this. Thank you for all the information. And whether it's yourself who can do the looking, or maybe somebody close to you, a good friend, a spouse, but somebody can start to look around and see what are the best options. In many cases, people watching this video may have already found the surgeon that they feel really comfortable with, and they've signed up for the surgery and they say, yes, this is, doctor, this is what I'm going to go ahead with. This study allows you to continue and have the surgery with that physician. You just need to enroll in the study before the surgery. That's the major piece.
So Deb, let's talk about the nuts and bolts of the trial itself. How do you get selected, or how do you get assigned to an arm, and what is an arm?
Well, the very first and most important piece is that patients can ask. So you can ask your surgeon, your medical oncologist, whomever you're seeing, whether you would be eligible for the PROSPER RCC study, and whether that study is happening at the hospital where you're being seen. Maybe that your doctor has a colleague who is offering the study. So the first important piece is that you ask, and if you're a clinician watching this video, we really hope that you'll offer the study to your patients. So it's important for patients to know that patients can enroll in this study if they can say yes to two questions. The first one is your kidney cancer amenable to surgery? So can you have surgery for your kidney cancer? And that could, interestingly, include a few isolated metastases. If they've said, oh, there's something else on your scan, as long as that can be removed, you're still eligible for this study. That's really important. So the first thing is, can you have surgery? And the second thing is this the first treatment for your kidney cancer? So you need to be able to say yes to both of those questions. Papers, you get randomized by the computer, and it would tell you whether you're in the first group or the second group. Now, both of those groups are going to surgery, but in the study group, I'll call it the group 1, that group is going to have one infusion of a drug called nivolumab. It's an immunotherapy agent, also called a checkpoint inhibitor. So people may have heard a lot about immunotherapy. So you would have one infusion before your surgery. You go in and have the surgery that you plan to have anyway. And then after the surgery, there would be an additional series of immunotherapy, sort of boosters, if you will. That would be up to 9 infusions afterwards, about a month apart. So you would have some additional treatment. Both study arms are going to be very closely followed all the way through. 'Cause, 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 'c to delay recurrence or potentially to prevent the recurrence from happening. That is absolutely a game changer for kidney cancer. And I would like to be here and alive and well when we say that we are successfully treating kidney cancer when we see it, and that we are, we're seeing significantly fewer patients end up with metastatic disease.
How can people get additional information if they don't have a doctor right now or they're looking for other resources?
Well, we know that patients are online. One of the things that I would recommend is that you find a patient group where you live. There are kidney cancer specific patient organizations that you can find, and there are too many to list right here. But find a kidney cancer patient organization and ask them about the PROSPER RCC trial. Ask your doctor at clinicaltrials.gov and keep asking.
I think we should take a moment to thank all of those people that are involved in this trial to date, especially the investigators, but more importantly, the patients that are already involved in it.
That's right. I personally want to give a special shout out to all of those patients who have signed up already and those who are going to sign up, because those are going to be our true heroes.